Hello, my name is Lauren Steimle, and I'm an assistant professor in the School of Industrial and Systems Engineering at Georgia Tech. Today, I'm going to be talking to you about how industrial engineering can help improve healthcare delivery. And when thinking about industrial engineering for healthcare delivery, I want you to think of the three rights and the three E's. So, a lot of my work focuses on the three rights in healthcare delivery. In particular, how can we get the right care to the right people at the right time? And so I think about these questions in a variety of contexts, but two kind of overarching umbrellas are public health or population level decision making, and then also individual level decision making or medical decision making. So under public health, I think of questions about how do we get the right care to the right people at the right time, especially in the areas of infectious disease outbreak prevention and control and healthcare access. And then on the medical decision-making side, a lot of the questions I focus on are related to prevention, treatment, and screening. So today I'll be giving you some examples of my work in the areas of polio, maternal health, and chronic diseases, which fall under these different categories. So when thinking about the right care and the right people at the right time, I think of these questions in infectious disease prevention and control. So one area that I'm working in is poliovirus. And when we're thinking about poliovirus and preventing outbreaks and stopping outbreaks, often we need to think about how to prioritize which people to give vaccines to and how to get them there at the right time, considering some of the logistical challenges. And so in particular, we're doing some modeling to look at which age groups should be prioritized and which subpopulations should be prioritized in order to receive vaccines to stop outbreaks. In the areas of medical decision making, often we're thinking about what is the right care or what is the right time to deliver care to people. So in particular for chronic disease management, often we're thinking about questions like this. When should someone start a blood pressure or medication or a cholesterol medication? And often these questions about what is the right care, what is the right time, depends on a patient's risk. And so we need to consider the patient's risk of having some adverse health event, like a heart attack or a stroke, and in which case that provides some medication would provide some benefit to that patient in terms of lowering their risk. But on the other hand, medications come along with side effects sometimes, and there's also cost to the patient. And so we need to think about what is the right time and what is the right care to kind of balance these trade-offs. In maternal health care, one example of where this comes up is whether a patient should deliver vaginally or via C-section if they've already had a C-section. And so delivering vaginally has some benefits in terms of reduced risk if the patient is actually able to deliver vaginally. However, if a patient has a trial of labor and is not able to successfully deliver vaginally and ends up needing a C-section, that can actually present some other complications that perhaps are worse off than if we had just planned ahead of time to have a C-section. And so here, again, these questions oftentimes involve risk and changing dynamics of how this risk evolves over time. In other areas of healthcare access modeling, the question might not even be what's the right care or right time, but how do we actually enable people to access the right care in a timely manner? And so one of the challenges here is that often specialty care, whether that's cancer care or maternity care, is often concentrated into a smaller number of facilities because specialty care is expensive. There's special technology, we might need teams of specialists that are in place, and there's benefits to having, in some cases, larger patient volume at these facilities that provide benefits. And so in this case, there's reasons that you might want to consolidate care into a small number of facilities. However, that comes at the cost of limiting access because some people are going to then have to travel farther to access this care. So this can present some trade-offs in terms of how much should we be concentrating care and where should lower levels of care that don't require specialists be distributed so that we're able to provide a good level of accessibility and risk appropriateness in these different areas. And so some of my students are focusing on these questions in Rwanda, focused on cancer care, and also in the US. And one of our recent studies is looking at the state of Georgia and how to prioritize risk-appropriate maternal care, balancing some of these trade-offs. And so again, these questions are challenging because of the trade-offs. Sometimes these trade-offs are changing over time. And so using traditional methods like randomized control trials might not be sufficient for answering questions about what's the best strategy to get the right care to the right people at the right time. And so as an industrial engineer, my group, we use mathematical models to answer these questions. So the idea is that rather than a randomized control trial in which you're only able to kind of compare a limited number of different strategies, we use mathematical models as kind of a policy sandbox. And so the idea is that we can build a model of the system that we're wanting to explore and consider different strategies within, and then use this model to explore which of these strategies are working well to deliver the right care to the right people at the right time. And so to give you a sense of what types of models I work with, my group and I work with compartmental models and agent-based models. We'll do risk prediction modeling to help better understand the trade-offs for an individual patient, and also Markov models to understand how risks and dynamics change over time. And then facility location and network design models to help us deliver or to provide accessible healthcare. And so those are approaches for answering the questions around the three rights. And again, these questions are further complicated by what we call the three E's. And so really our models are considering limited resources where we don't have an infinite number of dollars that we can, for example, spend on stopping outbreaks or providing specialty care across a state. So really this gets us into trade-offs about the three E's, which are effectiveness, efficiency, and equity. So when I'm saying effectiveness, I mean which of our solutions is going to give us the best outcomes. Efficiency would be focused on which solution is going to give us the lowest cost. Equity might be which solution is the most equitable. And oftentimes the answer to these three questions might be three very different solutions. And so using our models, we can try to find solutions that achieve a good balance across these three that's amenable to policymakers and satisfies what criteria that they're looking for. So again, just to conclude, just a reminder that industrial engineers can help you answer questions about the three rights. How do we get the right care to the right people at the right time? And also do this in a way that considers the three E's: effectiveness, efficiency, and equity. So with that, I'd like to thank the students that are doing a lot of great work answering these questions and building these models, and also the support for my group that has come from these different sources here. With that, I'll thank you, and I'll leave it there. Thank you.